So welcome everybody. My name's Denise Lewis. I'm the training officer for the Solihull Safeguarding Children's Partnership. We're here today on this webinar following a number of situations where cannabis has arisen in our practice. One of them's been in multi-agency audits where practitioners seemed a little bit confused about when and how cannabis use should be challenged. And another one is in our multi-agency audits where young people's use of cannabis seems to have perhaps not been given the focus that it should have done. When we discussed this with our multi-agency champions group, the champions decided that there was quite a bit of confusion in society as a whole around cannabis, and so they asked us to host this webinar. So I'm going to ask the people here today to introduce themselves and why we're all part of the webinar. So start with Vincent.
Yeah, I'm Vincent Jones. I'm a drug expert witness, in as much I work mainly in the forensic world. My primary role is really to advise courts in relation to cases that are presented to them in terms of drugs and drug offending, and to give an opinion on where this sits in the drug market, or if indeed it is, if there is a criminal offence at all, or how limited that offence is, i.e. roles, vulnerability, etc. But it is all within the forensic world, not treatment.
So thank you, Vincent. Deborah?
I'm Deb Dixon. I'm one of the lead practitioners in the practice development team in Solihull Children's Services, and so my role involves sort of driving practice, supporting with policies, and sort of developing training and development programs.
Yeah. Selena?
Hi, so I'm Selena Clark. I'm the senior practitioner at SIAS, which is Solihull Integrated Addiction Service, and I work with service users who are using substances.
Yeah. And Tim?
Yeah, I'm Tim Bruton. I'm a Sergeant West Midlands Police with the Solihull Prevention Hub. So I manage a couple of teams which include the school intervention prevention officers, early help team, and vulnerable adult. So it's all skills and preventative work.
Thank you, Tim. So the format of this webinar will take place in very much a discussion based now. So the question I'm going to ask the group to first consider is, what is cannabis?
Cannabis is obviously a natural plant. It's been around as far as I know, as long as the human race has, and it grows naturally. And it does flower and it does leaf, and just like any other plant, it will flower, and it will flower annually. If later on, if we get into this, clearly one of the problems we've got about that annual growth is the manipulation of the time and light factors that mean that we can now grow more cannabis in the same space than we ever could. And that's where most criminal enterprises enter the game. Its main psychoactive substance, which is concentrated in the bud, the flower, is delta-9 THC. That is the euphoric, that is the psychoactive component of cannabis. That's what makes it a recreational drug. Within that plant are at least 65 other cannabinoids that have been shown to, if in balance, can be both beneficial and harmful. And this is obviously where medicinal cannabis will come in. But for the most part, the cannabis that we see, and certainly the forensic world, is grown very much for THC. It's recreational. So it's done as a recreational drug with no thoughts to how it will react in medicine. That comes later. So.
Thanks, Vince. I just wonder if Selena wanted to come in there and tell us a little bit about why some of the people that you see may be using cannabis.
Lots of different reasons, really. For some people, they're using it to basically self-medicate. So they're wanting to sleep, they're struggling to sleep at night, or they are under a lot of stress and they're using it to relax on an evening or throughout the day. It could be for cultural reasons. So they've grown up in a family where that's just part of what the culture is. They smoke cannabis. It could be for social reasons. So people will smoke when they're around friends or to feel more creative. There's quite a few different reasons why people will smoke. There's a lot of peer pressure as well when it comes to the younger children. younger kids picking up cannabis tends to be a lot more peer pressure led.
Yeah, if we lots of different reasons for taking cannabis, so it might have lots of different impacts on somebody. So what might those be?
Okay, so cannabis basically slows down the central nervous system. So it can have an impact on your brain, on cognition. It can slow down reaction times, coordination, impact memory, perception, and your mood can change as well. Some of the physical effects, obviously, it slows down your breathing. It can affect your heart. It can make you feel more relaxed. So you can have a reduction in anxiety and stress. Like what Vincent said, if the THC levels are higher in cannabis, it can have a more hallucinogenic reaction. So you can get hallucinations, so you can see, hear, feel things that aren't there.
Okay. And we mentioned like young people actually using cannabis themselves. Do we know what the future impacts could be if they've used cannabis now?
I think it's a big question because there's been a lot of talks around it affecting mental health. A lot of the clients that come in who have been smoking cannabis from a young age may be more susceptible to psychosis, but I'm not sure on the studies around that, but it has been linked.
Yeah, and I guess like with all things that everybody's affected in different ways, isn't it? So what happens for one individual won't be the same for another individual. You mentioned, Vincent, medical cannabis earlier. What's the licensing conditions, etc., around medical cannabis? Because lots of people seem to think that you can now easily buy medical cannabis. Is that factual, or what does that mean?
Well, it's factual if you live in the United States, yes, but obviously in the UK. In the UK, there are 3 licensed products that contain cannabis. Only 3. The one that I've always known throughout my whole career is a thing called Sativex, which is produced within the UK and was originally licensed to be used for multiple sclerosis and certain conditions of multiple sclerosis that it was found to be effective in a very small cohort. So about 20 to 22% of people would get a benefit from it. That couldn't be used in the UK up until certain legal changes in 2018, where it could now be prescribed as a licensed product for users in the UK through the NHS. That's for multiple sclerosis. There is another one, and you have to send me on the name sometimes, Epidiolex. That's a CBD-based cannabis licensed product. That's used for rare forms of epilepsy, especially children. And the other one is Nabilone, which is a synthetic cannabis that is prescribed for people who, as an antiemetic in people having chemotherapy for cancer. So those are the only 3 licensed products in the UK that people can use and have a prescription for as a licensed drug. And those are the only conditions that they will be prescribed for at this point.
That's really interesting to hear, isn't it? Because we see marketing, particularly online, I think, about lots of products that have THC qualities, I think is the terms used. Yeah. So does that suggest either that they're not licensed or that they're coming from outside of the UK, or a combination of all of those things?
As far as the NHS is concerned, they're not licensed. Those are the 3 products that I've described are the only licensed products that I know within the UK that are backed by the NHS as legal prescriptions, and they have to be prescribed by specialist doctors, and they have to have. There's a lot of hoops they have to jump through, such as everything else being tried and it hasn't worked, and therefore we can move on to this and a prescription for medically supplied. And I suppose a medically prepared cannabis. I liken it to, we have street heroin, and then we have heroin that's used in hospitals, diamorphine that is clinically prepared, it's clean, and it's prescribed by experts, medical professionals, and it's administered in that way. So there are dismay in some respects. Sometimes it can dismay people because obviously we have to think, we're a big farmer in all this, because does this mean there's money in it? But clearly at the moment, those are the only 3 licensed products.
Okay, thanks. So, Tim, I guess that brings us into your world actually. If we've got unlicensed substances or we've got other products onto the street, what does that mean? What's the legality in relation to cannabis use in England at the moment?
Yeah. So cannabis is a Class B drug. And Vincent, being one of the experts around this, will know the different strains. But regularly we're seeing cannabis either in different forms. So there's a bud form that's being smoked. We're also seeing the derivatives of THC, whether that's synthetic, being used within vapes as well. So there is a bit of a crossover that we're seeing. Now there is it's illegal for possession, and that can mean that people could be subject to up to 5 years in prison at the extremity. But then also with possession with intent to supply, that can be up to about 14 years, I understand. Now, that is the top end in relation to criminality and the risks of this being a drug. We are sympathetic as a force, the reasons why people may be using cannabis. For those that first come to our attention being bought in possession, we do try and support, and we do try and look at intervention, look at education about those risks. So once people are potentially caught with these substances, we're looking at intervention through the likes of SIAS, through referrals. But that is kind of almost like a one-time option when these people are found. When they continue to be found in possession, or say the higher end, which would be supplying, either that's even passing to a friend, doesn't have to be for that gain. They are running the risk then of serious complications where they could be subject to criminal justice, brought before courts, and obviously the lack of liberty then if the people end up being sentenced. There's a big risk that we're finding for people where they're carrying and using just singly around the use of cannabis as a recreational drug. There are other crimes that potentially I can talk about that are then enabled or they run the risk of.
I think it's quite a complex area, isn't it, for people to navigate when we look at things across the globe, because we're seeing, aren't we, different countries, like Vince mentioned something about what's legal in the UK might be different to what's legal in the US. And we're seeing those sort of influences where some things are being legalized in some areas and not others, actually creating a confusion for everybody, particularly when we think about the online world, where people can see lots of different things advertised and freely available, but not always recognizing that that means that they could be breaking the law if that's happening in this country. So thinking about that, I know there's been a call, there hasn't there, nationally, to have a public health approach, to recognise that people are often involved with these complexities of not understanding the legalities of where they are. And like you've said, to not always go immediately into criminal action, but to look to see what else can be done. And I think that's quite relevant when we come to safeguarding. And this is where I want to ask Deborah a particular question. There's lots of concerns when we're coming to safeguarding that we obviously want to build relationships with families, and we want to understand the world from their perspective. And I know in Solihull we're particularly looking at restorative practice, and some people think restorative practice doesn't mean holding people to account or challenging the behaviours. And I want you to just explore what that means a little bit more for us, because if we've got parents whose behaviour, the case study that we've got, the parents were actually missing the ability to keep important appointments for their family or to carry out complete tasks for their family because of their substance misuse. How do professionals work in those environments in a restorative practice way?
I think, like from my own experience of working with children and families where cannabis use may have been a concern, I think, families and, young people as well can really worry that, we're looking to criminalise them, and, they go on the defensive. They feel worried about what they can share or, what they want to share, because they're sort of worried about the repercussions or maybe the reaction they get from us as a service. So I think, that we've got a big drive on restorative practice, and that's about sort of coming alongside families as well, and being curious and sort of, really, showing empathy and sort of wanting to understand, you know, their views on cannabis, the family's culture, you know, the beliefs, you know, why they use cannabis, and not just sort of going in hard, going, this is wrong, these are the effects, you're going to end up on a plan. You know, it's about sort of being open and sort of encouraging people to come up with their own solutions and sort of see those concerns themselves.
That sounds great and definitely the way we want to go forward. But in the audits that we saw that families actually then weren't challenged where there was having an impact on the family. And my understanding is restorative practice doesn't mean that we don't challenge. It actually means high challenge with high support.
Yeah.
And how often do we see that happening, and what could help that? What conditions could help that happen, I guess?
I think sometimes maybe workers or practitioners don't understand the impact, you know, the effects of cannabis. Or I think, you know, a lot of people do have strong opinions, don't they, on like legalization, or, you know, whether it's, you know, what it means to use cannabis, don't necessarily see it as a bad thing, or they might not understand the effects of different strains, like know the difference between, say, skunk and you know, other types of cannabis, so may not feel confident enough to have those challenging conversations.
What do we need to consider when we're working either with parents that might be using cannabis, or where we've got young people that might be using cannabis? What sort of risks may there be for them?
So that's it. So we talked about the initial basic of possession and possible possession with intent to supply, but they're not the only risks that are around the use of cannabis. So themselves, the fact that they've got to source these items illegally, which means they're going to be in contact with people. Either one, they're growing them themselves to use their own cannabis, or more than likely they're involved in people who are involved in drug dealing. That puts them in a lot of risk. So if we quickly look at the one of growing at home, as people might say, sometimes there's evidence of people growing in a setup within a setting. There's risks around the setup itself. We've known there to be house fires. We've known there to be serious incidents that have occurred where people have bypassed electricity to fund, as Vince would say, this cycle, these lights to try and get crops to be grown several times a year rather than a natural annual. It takes a lot of energy. And in doing so, they're putting themselves at risk within their familial homes, where they can set fires, they can end in real tragedies that we've seen across the UK. So even if they're trying to not get involved in criminality, the links to potential organised crime groups and the risks that they have, and contain it within their own household, there's still that risk. The wider risk there is that other one. Predominantly people get their cannabis and drugs from drug dealers, people that are supplying. And that in itself tends to be those that are involved in organised. Hand in hand with organised crime is the fact that money's made from it. And with that can come violence. So we know that there's often turf wars, there's gang situations around the supply of these drugs. And if these young people or families become indebted to people, they themselves may be either at risk of violence or debt bondage. So debt bondage could mean anything from they start owing more money than they've ever paid or were promised to pay for the substances they've had. So what we sometimes see as home invasions, where people's addresses are taken over, and that's either used then for the purposes of selling drugs, whether that's cannabis and other drugs such as Class A, crack, heroin, and cocaine, or whether their houses are then forced to be places to hide other things such as weapons, firearms, or even, for, as I said, setups are then being used in spare rooms where the organised crime groups are forcing them to grow. Children and younger people have a slightly different kind of risk because they're not going to have their own premises. But we hear things around county lines, which is a use of children in which to travel. That can be short distances, it can be longer distances across the UK to take drugs to other places. And the reason that gangs use them is quite often children are young, they won't have a footprint in the justice system. They sell them that they're either going to get a promise of money, threat of harm, or that nothing would happen to them because they're young. That's not the case. It puts them at risk of harm to others whilst they're travelling, puts them at risk of harm from that exploitation, that they can come up to various harms, but also that they'll be involved in the criminal justice and arrested for serious offences. So they're kind of an idea of some of the I'd say one more I'll touch upon is the familial risk, where you have said, Denise, it is kind of normalised to a degree at point.
Mhm.
When I was 20 years old joining the police, I knew of people that may have used cannabis and peers at a younger age. And for me, it was almost normalised when I joined. Then I saw the risks around psychosis and how damaging that is to individuals, their health, and those that are around them. But more so, I've seen the exploitation and what can happen, or even simple things such as generational usage being normalised, and then that family normal life, which can be travelling and travelling in a vehicle. People are driving whilst under the influence, and the risk that puts themselves, and more importantly as well, their children, is devastating. It's very much like drink driving. If you're under the influence of cannabis, it impairs your reactions, as Selena and Vincent have said, and that's the risk of serious harm, of crashes and death. So that's
Okay.
the severity that we can see in these.
That's a really interesting point, though, isn't it? Because we've run a lot of campaigns, particularly aimed at parents with small babies, about who's in charge and asking them to think about who's in charge if the family are going out, if they are having, alcohol, a illegal substance, is somebody not is refraining from taking that and actually being in charge of a baby. I don't know, when Deborah, do you want to add anything into there about some of the things that we need to consider that could happen if perhaps somebody fell asleep with their child, if they were under the cannabis or anything like that?
I think, if you're under the influence of cannabis, caring for a small child, I mean, if there's a baby, if you've got a little baby, you're asleep with them on the sofa, if they roll off and hurt themselves, or they could fall against a radiator and, for example, and, sort of get burned, or they're left to cry in their room, and you're sleeping so deeply you don't responding to their basic needs.
And I think some of the worst case scenarios where we've seen co-sleeping means if
Yes.
somebody's really not.
Suffocation. Yeah.
That's right. So it's very easy to roll over and smother your baby, or if you're on the settee, for the baby to fall down the side of the settee or something like that happen. So really important risk factors to see there. Selena, coming from working with people that are accessing your services for support, many you've mentioned, lots of people for different reasons. Any sort of particular points for consideration and help that people are seeking that could be shared, do you think?
What I would say is that what we often get is people coming in who are using all substances, but if we're focusing on cannabis, they'll come in and say, I felt really judged by other professionals, so I didn't want to come in, I didn't want to share how much I'm using, and it's been a while and I haven't been able to get support because I felt judged. When people come in to SIAS, we talk to them about triggers, talk to them about the reasons why they're using, because that's the biggest thing. Often you'll find that people are using cannabis for reasons that can be solved quite easily, maybe going to the GP, or going to a mental health service, or perhaps going to the gym, getting a different social group. So it's looking at triggers basically and looking at ways to cope. I think sometimes people will come in and they'll just say, I like using. There is nothing that I want to do. I don't want to change my behaviours. I like using. It does something for me. And because we're a service where it's voluntary, we have to take that on board. Yeah.
And I think that's really interesting, isn't it? Because I think that's a perfectly matter of fact thing for somebody to say, but when we're thinking about then safeguarding their children, it's something else that raises another discussion, isn't it? Because what's being put first, and we know that some people can smoke cannabis and show very little impact at all, but others it can have a massive impact. So it can't be one size fits all. But I think the thing that you hit the nail on the head there with was the non-judgmental approach. People will expect that Tim's going to come from a police perspective, so he has a legal duty there. But when we're thinking about other services providing support for social care, etc., then we really do need to think about what else can happen where we can all take that non-judgmental approach.
Yeah. I think often sometimes there's other factors involved, isn't there? There could be DV going on, like I say, mental health going on, and they're sort of using to basically cover that. Once the other stuff are sorted out, generally you see reduction in their use. When you talk about their children and what they want to do, often you'll find that they don't want to be smoking. They don't want to smoke if they've got children. They're aware that they need to be alert and looking after the children, need to attend appointments. And you do find with cannabis that that's what they struggle with, because, you know, it relaxes you, because you're cognitive a little bit more impaired. You do struggle with them sort of things, and they find that when they're reducing down, they're actually more capable of attending them appointments and making sure that, you know, they're getting the kids to school on time. So it's just looking at what can be done outside of cannabis sometimes, if you get my meaning.
Yep, certainly. Tim?
Yeah, that's really important. Selena saying about the non-judgmental. I know obviously we have laws and there's enforcement, but there is also proportionality to it. And what I've found in the past sometime in my role as the detective before and within these teams is that sometimes a barrier to people reporting a crime is their usage of cannabis or drugs, and their fear that if these come into the home or if they report, that we will act solely on that and ignore the matter in which they're reporting. And that isn't the case. I've had it before where there's been serious offences, you know, domestic violence, serious sexual offences and assault. And that's been a barrier for that person because of their usage, thinking, should I contact the police? For fear that the smell of cannabis on them, or that admitting that when something happened, they were under influence of that. I'd like to try and say that that is not the case. It's considered. We will be proportionate. And when I've investigated matters of that seriousness, they are seen as victims and how we can support them. The uses around drugs and then cannabis is something that we try to gain signposts, to get referrals, to get support. We don't want that to be a barrier to them putting up with some horrific and horrible things that they may be subjected to or witness to.
I think that's a really important point, Tim, isn't it? Because we do know, don't we, that people who groom and control others will actually use substances like cannabis to aid that. So the actual person that might appear as if they're choosing to use substances may not be having that choice. That could be controlled by the person who's grooming or controlling them. And we need to be really careful as professionals that we don't hold them accountable for drug use that is beyond their control to do anything about.
No, that's right. And that's why there are processes involved when we're looking at people who are being exploited. There's multi-agency approaches where we can refer people in, exploitation, greening tools that come in, the exploitation hubs where they're discussed, and then the multi-agency approach, I'm outside the home and that sort of thing, where we can discuss the support for these people. And then the extremity of that is the national referral mechanism. So if we do think that people are being subject to modern day slavery, trafficking, such as at county lines, the support that we can get through that, and we can recognise if they're being forced into criminality, that's a potential offer of defence or support for them. So we do try and be balanced and really work together to try and prevent that for them.
And I think we've got similar multi-agency responses to where we've got domestic abuse concerns, haven't we? So if we had somebody in a home who was controlling their partner and perhaps using the substances like cannabis to do that, rather than locate the blame of the use with the person, we need to think about that multi-agency approach to how can we all work together to make sure that the right support is. And like Selena's just realised that, you know, for us, that if we can remove some of the issues, some of the stressors that the family are experiencing, then there's less likely to be the need and use of something like cannabis. But we need to really understand what those mean. Deborah, I want to bring you in again here. When we're thinking about understanding the needs of all the family, how do we ensure that we're considering each person as an individual? Are there any models that we could think about to explore what life is like for each individual?
It's just a sort of trying to, you know, you take sort of a holistic approach to the whole family. It's not just, you know, say, you know, building a relationship with dad because he's the one using cannabis. It's sort of involving the whole family in that plan and the intervention to understand what life is like for each person in that household. You know, are they aware of the cannabis use? Is there another adult in the house who doesn't use substances? And you know,
and we mentioned earlier, didn't we, about cultural needs?
Yes.
And the need to understand the impact of those. That's not just on the family as a whole, is it? That can be impacting on each individual differently.
Yes, depending on the age of the child as well, and what their care needs are. Whether if there's a young baby in the household, they're going to need someone who's more hands-on and available than a 17-year-old teenager. But of course, that teenager is vulnerable in their own right. Whether they've started smoking cannabis with a parent, whether like it's a generational thing as well, like the family culture is that they all smoke together.
So it's really important, isn't it, to think, you mentioned again about engaging fathers as much as engaging mothers. And we know in many of our assessments at the moment, it's often the mothers that are assessed far more than the fathers.
Yes.
So what you're raising there is definitely a reason that every single member of the family should be included.
Yes, definitely. I think, there's a safeguarding practice review, I think, about baby Eva as well, about, the father's use of cannabis was a concern in that situation. And there's a study, I think it was at 2021, about hidden men in the home as well, sort of understanding what those relationships are like, and whether, mothers feel unable to share what relationships they have with their partners, because sometimes they're scared to say who they've got a man coming round, because maybe that they'll get reported to housing for having an extra person in the home, or things like that as well. And it's about being curious, isn't it, as to sort of what people's relationships are and what's actually who's coming and going from the home.
Of our service, we have a family service. So when we speak to clients, we're looking at who's around them, what interactions they're having, not only within the household, but what sort of family they've got outside that, what sort of friends they've got. So I don't know, it could be nan, it could be the best friend. And often we'll get them people, the aunt or whoever, to come in and have support of their own, because they're seeing more than what we do. So They're going into the house more often. They're seeing the kids more often. So if they're getting support and they're coming in and they're disclosing certain things, it's keeping that child more safe. But it's giving the family member who's using more support. Because if the more people are aware of what use is like and how they can support that individual, the better they'll all be, really.
Definitely.
That's great, Selina, and that's really leading us on to where the government's leading us as well, isn't it? So where the new guidance from our Family First programme is very much telling us that we need to think about those natural networks for families, because that's where they're more likely to seek support and feel comfortable seeking support. So if we are having input as professionals, we know that that's usually time limited. And when we walk away, it's important to make sure that there are those networks of support that the family trust, that can continue to provide that ongoing support and work where it's required. So that's a really important one. So one of the things that I want to just recap, because one of the things that kept coming forward for some of the neglect champions, what do they do if they've got perhaps somebody dropping off their child at school or nursery and they feel that they can smell cannabis? How might they approach that subject, do you think? And where might they signpost people to?
I imagine some people will notify the police as the first port of call. It's probably not the best place to go, but I think people just naturally do call the police or the emergency services when something like that happens.
And I think, Vincent, you saying naturally that may not be the best place to go. I think that's really accurate for safeguarding, because if we think that early relationship with that setting needs to continue to help to safeguard children and to keep their best intentions, then to call the police with no prior conversation or knowledge just because they've smelt cannabis could be quite breaking of that relationship. So any other thoughts at how things might progress?
So we have a safe and sound team. We have a YP, a young team, and our practitioners go into schools. So they have conversations with not only the teachers, but they have conversations with the students as well. So hopefully from that, in them sort of settings, they're actually contacting social services, or they would call up SIAS and ask the question. Hopefully they're speaking to the parent beforehand. They're actually having that conversation
that's
with
the
the
really
parent.
important thing, isn't it? I think that's the really important thing. And I think Vincent was right to come in with saying calling the police, because lots of people will think, oh, this is an illegal substance, I need to report it. And actually, we do need to think about, let's have a conversation, a non-judgmental approach.
But can I
I
just
think,
say, from a personal
yeah.
point of view, I think, yes, speaking to the parent or the person that's dropped them off, but to my, that's preferable. But I know not everyone's comfortable with confronting people.
Yeah, but if we've got professionals expected to take a safeguarding or promoting the welfare approach, that is what we would expect people to do, is to have that initial conversation in a non-judgmental way. I guess the one thing we've mentioned is about dropping off or picking up, and I know, Tim, you raised earlier the part about being aware of substance misuse and driving, and I didn't know whether you wanted to say a little bit more about that.
Yeah, and I think I say, Vincent's saying naturally people might call the police, but we're not always the best port of call for that at that time if we're trying to work with family. I suppose we are that extremity of it. So if we were having a child dropped off, parent is, under the influence of cannabis, they can smell it, but it looks like there's a clear impairment with them. We know there's another child in the car that they're going to be taken to another school. But there are those risks that I've said about they can be involved in crashes. So it is being balanced and aware to that. If that person looks as though they are incapable to drive, now it might be a difficult judgment call to make. Much like, say, people under the influence of alcohol. We know the extremities of alcohol. It might be the same. I know they display differently, but there's similar extremities that you may see with cannabis. But just trying to think about that judgment call of, is someone else at risk of harm from that person at that time? If it's more about this prolonged usage of cannabis, it is that support element. So it is kind of being aware and open to it. Try not to be judgmental, but with the extremities being consideration to calling the police if we think there's going to be harm.
Yeah, the safety element first, isn't it? But I guess what we've all been exploring on here is some of the nuances that we need to explore with families about why that use is happening and why people might not be upfront to owning that use at the moment. Lots of the nurseries particularly, and some of the schools have said to us that when they say, oh, we can smell cannabis on your child, they say, oh, it's just because somebody on the bus or somebody on the way here, but it's something that keeps occurring. And then the professionals don't always feel comfortable to go back and have that conversation again. But I'm thinking that that's something that does need to happen if it's done in a non-judgmental way. Tim?
My new favourite word, non-judgmental, but again for the children as well, when we've got children, particularly say secondary school age, where they are being dropped off at school and there's a smell of cannabis on them, it may not be them and it may be parents, as we're aware, or even their parents' coat being on top of their coat as they're travelling. Schools and the sort can't ignore it. They will have inquiries and speak to that child. They may know the family, but they will also potentially look at using their own powers under the Education Act, which is search, just to make sure they haven't got prohibited items. So again, it's that nuance, that balance. Try not to vilify a poor child that they smell of cannabis, which, yeah, we want to educate them if they have, but even if it might not even be theirs. So it is a difficult one to navigate, but we just have to be wary and mindful of.
So I think what we're coming back to is important to be sensitive. Our favourite words for this one is definitely important. Thank you for Selena to bring that in for non-judgmental approach. And I think we've emphasised the need to having multi-agency support, because we've all bringing different parts of this discussion together, and that just shows the different amount of knowledge that we can get if we bring multi-agency people around the table. Is there anything else that anybody wants to bring into this conversation before we conclude today?
I talk about the extremities, but it's so important that partners and people who see children regularly are part of our kind of intelligence picture, because we don't want to be going after children and vulnerable adults that are using cannabis. We want to be going after those organised crime groups. We want to be going those that are going to seek to exploit children and vulnerable people and cause them serious harm. And the only way we can do so is via intelligence. And quite often, I think that some professionals have intelligence and they don't realise it. They know things that I always say sometimes it's the best kept secret because so many people know it, but no one shared it with the police. So it's just again around the, if they're dealing with people who they think are being exploited, it's trying to find out the details about who, modes of travel, vehicle details, nicknames, contact numbers, online platforms, whatever it is that's going to help us as a collective try and make these people safe and take the wrong people off the streets who are going to try and harm them. So it's just a bit of a push and ask, as always, just to share those partner intelligence reports through to our intelligence. Again, it always seeks corroboration, non-judgmental. We try and make sure that we use it in the correct way to aid myself for intervention or some of my colleagues for that pursuit of those that are trying to harm.
That's great. Thanks, Tim. And just a reminder to everybody that intelligence form's available on the Solihull Safeguarding Children's Partnership website. But along with that, there's lots of other guides on there. And there's a particular guide that's been developed that's relevant for this conversation, which was some work carried out between the partnership and with SIAS. And there's a drug and alcohol substance misuse tool to use with parents to aid some of the questions that you might need to ask to decide what impact their drug use may be having on their children and what support might be needed in a non-judgmental way. And if that form, if the questions in that are used and parents do want to have support, then if that's completed and sent into SIAS have advised us that that will mean that they'll get a quicker response to their service. So just a reminder that that form's available to everyone.